Hi, my name is Uzma, for those who don't know me. And today I'm making this video to talk about Metastatic Breast Cancer Day, which is today, October 13th. And the reason I'm choosing to make this video is to spread more awareness about metastatic breast cancer. So first of all, let me explain what metastatic breast cancer is. So, when people are diagnosed with breast cancer, as the name implies, breast cancer means having cancer in the breast, and sometimes the cancer goes into the lymph nodes in the armpit, called the axillary lymph nodes, and based on that, a person is staged in terms of whether they have stage 0, stage 1, stage 2, stage 3 cancer. So metastatic cancer is when the cancer has left the breast and the lymph nodes in the armpit and now has spread to other organs in the body. Now, breast cancer as a disease tends to spread either in the liver, the lung, the bones, or the brain. So those are the typical 4 sites at which metastatic lesions are found in somebody with breast cancer. So the other name for metastatic breast cancer is also called secondary breast cancer or stage 4 cancer. So with stage 4 cancer, the treatment goals change, and people or the oncologists or the doctors no longer are now trying to cure the cancer, but they're trying to make it manageable and keep it under control. So once somebody has been diagnosed with stage 4 breast cancer or metastatic breast cancer, they tend to stay in treatment. The only exceptions are people who have done incredibly well on treatments for 5-10 years, and then their doctors may decide that they are in remission now. So there's no cure that goes along with stage 4 breast cancer typically, and most people stay in treatment as long as they're alive. And these treatments can involve oral chemotherapy pills or targeted treatments and chemotherapy infusions. So in some way, shape, or form, the person is consistently in treatment. The other thing is, because doctors know that cancer is present, there are ongoing scans. So a person goes through scans every 3 months, and it's the preference of the doctor. Some people go through PET scans, or some people go through CT scans and bone scan as a combination, because oncologists really want to look at if the cancer is growing, as in the term progression, or it's actually getting smaller, which is the term regression. So the scans are done every 3 months typically for a patient with metastatic breast cancer. And based on the results of those scans, then the doctors determine whether this person needs to stay on this treatment or this treatment is no longer working. Now, the typical course for metastatic breast cancer is that when a person's diagnosed with metastatic breast cancer, they will get started on a course of treatment. And it's very typical that that treatment may fail at some point in time. So it could be 9 years, it could be 1 year, it could be 9 months, and then the patient gets transitioned to the second line of treatment. And because cancer mutates, it's part of the pathology of the cancer cell is that it changes and mutates. It is very hard for one treatment to work for a really long time. Now, there are metastatic breast cancer survivors who've lived 15, 17, 20 years, and there's actually a study going on in UW-Madison where they're trying to study these super responders to see exactly what is different about these people that they stay alive for so long. The median survivor for metastatic breast cancer is 3 years or 36 months. And there's a significant variation on the survival based on where the metastatic lesion is and how the cancer is responding to a particular treatment a patient is in. So people who have just bone metastases tend to survive much longer than people who have soft tissue metastases, and by soft tissue I mean lung, liver, or brain. So it is a terminal disease in a sense. It's an incurable disease, but there are ways to slow the progression. But on a day-to-day basis, knowing that you live with cancer in your body is very hard. It's a daily exercise in patience, in gratitude, in taking care of yourself, in reframing how you think about life, because living with a diagnosis that you know eventually is going to kill you is not a very pleasant thing. Also, people who are in metastatic breast cancer treatment cope with fatigue, they cope with multiple side effects. As you can see, I've got little hair growing. It's because I'm on a particular medication that doesn't cause hair loss, but it's entirely possible that my scans show progression and then I get transitioned back to chemotherapy and I may not have hair again. So having hair or not having hair has nothing to do with whether a person is doing better or not. It just means that they're on a particular kind of treatment that allows a person to have hair. So, for example, when I was on Ibrance for 9 months, I had my hair. I didn't lose any hair because our Ibrance or palbociclib is a very targeted treatment, and it doesn't cause hair loss. Then I ended up with IV infusion chemotherapy with Taxotere, and that causes hair loss. So I had lost my hair again. And now I'm on Xeloda, which is an oral chemotherapy, and I get to keep my hair, or at least grow them a little bit. So the reason I'm talking about this is because people who don't have cancer really don't want to hear about terrible cancers, and people who have had breast cancer don't want to think about becoming metastatic because it's very scary. It's scary for cancer to come back. It's devastating. It's emotionally very stressful, especially for a young person. But at the same time, if you all come together in terms of advocacy and trying to get more research funding for metastatic breast cancer, then it is no longer scary. If we have treatment, then metastatic breast cancer is no longer scary in terms of being incurable. So the other thing is that it's not fault of the metastatic patient or the breast cancer patient that they became metastatic. It can happen to anybody who's diagnosed with stage 1 or stage 3 cancer. So of course the odds of somebody who had stage 3 cancers are much higher of recurrence, but it doesn't really mean that the person who had metastatic breast cancer did something wrong, or they did not take their treatment, or did not follow up with their oncologist, that the cancer returned. It's the nature of cancer that it mutates and it has a tendency to recur. And the most famous celebrity example is that of Olivia Newton-John, whose cancer returned after 20 years. So there are some cancers that are very slow growing and may recur after many, many years, or there are some cancers that, respond to treatment completely and never come back. So today, I think it's very important for us to know things about metastatic breast cancer. October 13th is Metastatic Breast Cancer Day, and we certainly, all of us in the breast cancer survivor community and those with metastatic breast cancer, we want to come together and basically hope for a cure and for treatments that can stop progression of cancer, cure us of that disease. I know cure is far away, but there's much research going on, and there's certainly hope of extending life, if nothing else. But there are friends of mine who are not responding to treatment and are transitioning to palliative care and hospice care. And it's very hard because in terms of statistics, we lose 40,000 women every year to metastatic breast cancer, or 113 women to breast cancer every day. And that's a big number. And as as a medical community, we need to do better. I appreciate you listening to me and learning a few things about breast cancer. Thank you so much.